present. Okay, well, thank you for joining. This is a webinar to talk about the findings from More in Commons research into public attitudes on assisted dying ahead of the second reading of the Assisted Dying Bill on Friday. Just a couple of things to say at the start. We take no view overall on the legislation. In fact, luckily, or not luckily, the authors of this report themselves, it turned out, all took very different views on the legislation being proposed. Our interest is in making sure that the public's views are surfaced and that the nuances of public opinion are understood as one, obviously not the only data point that parliamentarians might wish to consider as they move towards making a decision on how to vote. So that's the first thing to say. We are neutral, so to speak, on the legislation, although we do have some thoughts based on public opinion about what should happen next. The second thing to say, simply because some people have asked, and it's an entirely legitimate question, not least as we're members of the British Polling Council, this report was not funded by anyone on either side of the debate, and indeed by no one external. For issues such as this, we tend to self-fund. All of our research is editorially independent, but on issues like this, we think it's particularly important that we have not shown, consulted, given influence to either side on shaping the research design or questions. So it also means if you have any issues with the research, it's entirely on me rather than anyone else as well. So what did we do? So we started this research shortly after the general election. We've been tracking the sort of headline support for the principle of assisted dying actually for quite a while now, a couple of years, but we started in earnest in recognition of the fact that a vote was likely, tracking opinion from the summer onwards, and we have been polling people repeatedly since the summer. So in total, this study is based on polling of over 15,000 people that we have spoken to. A couple of things to add to that. Around 10,000 of those people go into our MRP, which you will see. But just to be absolutely clear as well, because some people have asked, all of the headline stats are taken from the 2,000-person nationally representative survey that we did in November. The reason for that is we wanted the final figures to be as up to date as possible, because we know that public opinion can change on such a sensitive issue. And we also conducted focus groups throughout the autumn. So what is the headline? The headline, and this is, reassuringly, this is consistent across our polling and other polling, is that two-fifths of Britons support the principle of assisted dying, only 13% oppose it, and then you get a chunk in the middle, around 22, 23%, who say they neither support or oppose. They tend not to know, or tend to be sort of, wrestling with the different arguments. What is striking about assisted dying compared to almost any other piece of opinion research that we do is it's really hard to detect differences along lots of the major demographic lines. So if you look, there is relatively little difference by gender, by education level, or region of the UK. There is an age difference. Older people are more likely to support assisted dying. Younger people are not actually more opposed. They're just more likely to say that they neither support nor oppose or don't know. And what you find from the focus group conversations is, perhaps understandably, that younger people have spent less time thinking about this issue and reflecting on it, whether it's reflecting on their own lives or having lost relatives, whereas older people have. And I think, again, the thing which I would really stress is, more than almost any other issue that we talk about, with people. People's personal experience really shapes how they think about this debate and the issues involved. It is something where the experience of losing people or of knowing people who are elderly and infirm has an impact on how people think about the issues involved. There also, as was on the previous slide, isn't a political divide on this. And just to flick back to that, if you look, Reform UK and Green Party voters are almost as likely to support the principle of assisted dying, which again is quite unusual when it comes to an issue like this. Normally you see gradients of support, and certainly you do on lots of other more hot-button issues, such as immigration. So again, when you're talking about the principle of assisted dying, and I will go on to say that it is not unconditional support, there are very many caveats and safeguards that the public would want to see if assisted dying were legalized, but there aren't those divides. There are some divides. Again, they're not huge, and I don't want to overstate them, but they're worth reflecting on when it comes to some of you who have worked with us before, particularly in the media, will be familiar with More in Common's British 7 segments. There are some divides, and there are two groups who are clearly, particularly strongly in favour, quite significantly above the national average. They are the progressive activists. They are the most left-leaning group. They are sort of the core of the Labour Party's support, or have been previously. Actually, quite a few of them moved to the Greens at the last election, but they are the sort of most left liberal segment, and you would expect them to be in support because they tend generally to be in support of social change like this. Interestingly, though, they are joined in having unusually high levels of support by our loyal national segment. That is the segment of the population that basically best reflects what we think of as a typical red wall voter, that group of voters who swung from Labour to Boris Johnson in 2019 and then swung back to Labour and a little bit to Reform UK in 2024. They tend to be more socially conservative, but economically left-leaning. In focus group conversations with this group, it's very clear that, actually Loyal Nationals, a group, probably have reflected on death more than the other segments. They also have quite high threat perception as a group and see assisted dying as a way of mitigating the potential for suffering for them or their loved ones. On the flip side, and again, I should stress with these two segments, it is still a majority who support the principle of assisted dying, but they are slightly below average. Backbone conservatives, slightly below average. That tends to be informed by their higher than average religiosity, but also general skepticism of social change. They're informing those slightly higher levels of opposition. It's within the margin. Established liberals are the other segment, which I would draw out. They're kind of similar to what you imagine by a blue wall voter, I guess, a sort of Cameronite conservative, quite socially liberal, more economically right. Again, you might be perplexing that this group is the one which has relatively lower support. For established liberals, it tends to be, again, in conversation, the fact that they are relatively happier with the status quo. They're a more secure, comfortable group in general, and also they're a group who are more likely to have heard about what's happening internationally and perhaps be worried about slippery slope arguments. The disengaged traditionalist group you'll see has a big group who say neither support nor oppose. That is largely a product of disengagement. This is not a group who particularly think about live political debates, so they're much more focused on how things affect them in their day-to-day. One of the striking things, which certainly I didn't know until I started doing this research, is that support for assisted dying hasn't really changed, and it hasn't really changed for a long time. So if you look at the British Social Attitude Survey, they have been tracking support for assisted dying since 1983, and it was 77% support then. It's 77 support the last time that they did it in 2016, so it goes back. Interestingly, Gallup asked a question which is very similar in 1950 and found that support for assisted dying with proper safeguards, again, had 2-to-1 support. So again, this issue is quite different because it's not one of those issues where it's a product of increasing social liberalism, like we've seen on some other issues, for instance, gay rights, where there have been quite dramatic shifts. And that's why you've ended up with big majorities in favor of things like gay marriage. This has actually been consistent over a longer period of time. This really does need to be stressed, and it's clearly something that is going to have to be thought about. And you see from the way the debate is playing out in the media, is being thought about. Strong support for assisted dying is not the same as unconditional support. In fact, the public would be far more in favor of a more restrictive eligibility regime with robust safeguards compared to lower safeguards that reduce barriers to being able to access it. And what's interesting, actually, is, again, we talked about that Loyal National, that Red Wall voter segment. They are among the most in favor. They are also amongst the most in favor of having strict safeguards in place as well. So, there is not a tension in the public's mind between support for legalization in principle and having that strong safeguard regime. I said that life experience tends to shape how people feel about assisted dying. What is quite interesting is that particularly expresses itself with those who have lost a parent within the last 5 years. They are 18% more likely to strongly support assisted dying than people who have not lost a parent recently. So that experience of loss seems to shape people's views in favor. Similarly, people who have had a terminally ill family member are 9 points more likely to strongly support assisted dying. And also people in poor health as well, 11 points more likely to strongly support assisted dying. And again, from the focus group conversations, what we picked up is that people's experience of loss and seeing a loved one pass away tended to make them think that they would have liked the family member involved to have had more control over their death. We spoke to a lot of people who had relatives with experience of suffering, and they felt that had they been able to access assisted dying, they would have been able to have a more dignified death. I should say, though, again, what's interesting is despite the fact that those who have lost a parent or who've had a terminally ill family member or who are in ill health are more likely than average to strongly support assisted dying, they're also more likely to support strong safeguards. So again, it's really interesting. Some of the groups who are most in favor of assisted dying in principle also the most likely to want strong safeguards. Again, informed by their life experience of having had a vulnerable family member, towards the end of their life. That informs the fact that they know that strong safeguards will need to be in place. It's worth also just reflecting on how malleable Britain's views are on assisted dying. We know that there is headline support in favour. We know that some people are very strongly in favour, some people are very strongly opposed. What is interesting is we tried an experiment in one of the polls that we conducted where we asked people at the start of the survey how they felt about the issue of assisted dying, and we asked people at the end. And throughout that survey, they were exposed to arguments for and against assisted dying. What's interesting is that 32% of Britons move along the spectrum after taking that survey, after hearing about the issues. And the flow, I should say, goes in both directions. What tends to happen is not that people move from strong support to opposition, but they will move from strongly support to somewhat support, or somewhat support to strongly support. So again, it works in both ways. Some people move from somewhat support to neither support nor oppose. Some people move the other way as well. So it's really interesting that people are moved and shaped by the arguments on this issue, which is why, it's only around 4 in 10 say they are very certain on their views on this matter. And I think what, again, is interesting is in focus group conversations, again, people rarely shift entirely, but when you get onto discussions about safeguarding, it is very clear that if people don't think they can be satisfied that there are strong safeguards in place, they become less likely to support the principle of assisted dying. So that safeguarding regime really matters. When you test the specific wording in the assisted dying bill, the headline support is basically the same as headline support for the principle of assisted dying. So we put the key measures in the bill into a question, and this is what comes out. So 64 to 11 in favour, about a quarter neither support nor oppose. But there are some areas, so you get that, again, that strong support for the main thrust of the bill, but some areas where the bill differs from public preferences, which I will go on to. Which arguments persuade people in favour or against assisted dying? Again, lots of things which is unusual about this debate. One thing which is particularly striking is that even people who have, and you hear this particularly in the focus groups, even people who have a strong view one way or another tend to be able to appreciate, and in fact often agree with, the arguments on the other side. So what we find is that the most compelling arguments in favour are that those who are terminally ill should have the right. It's the autonomy argument, and particularly allowing people to escape insufferable pain. What's interesting is that even opponents of assisted dying say that they find that argument convincing, which is interesting. Another argument which both supporters and opponents tended to agree with was that because people are already travelling to Switzerland, we could impose greater restrictions than what is happening already. And I should say it doesn't really come up as much in the focus groups, but it is in the polling. But it is a compelling argument, particularly in the focus groups. Is there was concern about the inequity of the current situation, with people feeling that the wealthy essentially had a get-out clause of being able to go to Switzerland if they could afford it, but those who don't have the financial means or who are too ill to be able to travel do not. So that did resonate. Looking at the arguments against, again, it's interesting that while only 13% of the country say they oppose assisted dying, 58% of the public find convincing the argument that the elderly may be pressured to seek out assisted dying because they worry about being a burden or because they're being pressured to choosing assisted dying. So that worry about coercion and pressure resonates across supporters and opponents of assisted dying alike. In fact, there's actually very little difference if you look at the little dots there. Arguments which tend to be less convincing overall are around issues around the sort of slippery slope, perhaps less convincing to people. We found assisted dying going against people's religious belief tends not to be as convincing an argument. Interestingly, even for people who are religious, their reasons for opposing assisted dying tended not to be religious ones that they would make. It doesn't show up as strongly as in the quant as an argument against, but certainly in the focus groups, there was discussion about the potential impact of broadening the scope of assisted dying in that it may devalue the lives of people with severe disabilities. So again, in conversation, it's an argument which people find powerful. So, what do the public want and expect in terms of the process when it comes to this bill and potential legalization or setting up any system? So, the key thing is that the public do want to see more consultation and engagement. It's fair to say that the public, and particularly in the focus group conversations, feel like on an issue like this, they kind of expected more discussion. They sort of thought there would be more things, for instance, sort of BBC Question Time style events and debates and that sort of thing. So we're not necessarily talking about a formal consultation here, as you know, like formal consultations appeal to the highly engaged rather than the general public. Instead, it's more, why is there not more kind of wider discussion going on? That said, people tend not to think that that debating this bill on Friday is too quick. So only around 20% think it's too quick, 13% too slow, 51% around the right timing. So it is less, there is no public appetite, and this is one thing which comes through really strongly in the call for sort of long pressing this issue, but there is an appetite for how do you get better engagement, and who should that engagement involve? Interestingly, public, they think it's important that they are involved, but much more so, they want engagement with terminally ill patients, families of people who've gone through assisted dying abroad, doctors, nurses, medical professionals, and those with disabilities are the top groups that people expect to see consulted. And certainly, if the bill receives a second reading and goes to committee stage, real thought needs to be given to how to reflect those voices in any evidence sessions. What about how MPs should vote? Should they go in line with their conscience or in line with their constituents? I wish we could bring you a more conclusive answer on that, but in fact, the public split down the middle, about a third, slightly more than a third say in line with their conscience, slightly more than a third say in line with what their constituents think, and the rest don't know. It's worth saying that Conservative and Reform voters are more likely to say in line with constituents. Labour and Lib Dem voters are more likely to say in line with their conscience, or it is marginal. If people were, again, on the principle, to vote in line with their constituents, you can see from the map that in general, well, in fact, there are only 7 constituencies in the UK where support is under 50%. And you can go on our website if you want and find out what support is like in different constituencies. This is using MRP modelling. And there are no constituencies where opposition is higher than support. But again, we would never say public opinion should be the only determinant, despite the fact we share it, and the public are somewhat split on that. So, all that said, support for the principle, wanting consultation on the process, what do the public think that getting the policy right should look like? As I hopefully have stressed throughout this, the key here are strong safeguards. This is the public support is absolutely contingent on them. And number one, perhaps unsurprisingly, given when we talked about arguments for and against, that the strongest argument against was worries about the elderly and vulnerable being coerced. It is proof that someone isn't being pressured. There isn't that in the current bill, and it may be something that MPs, again, if the bill receives a second reading, choose to reflect on whether there is more of a mechanism for including that. Obviously, there are the medical checks and the legal checks in the current bill, whether they should more explicitly bring that out. Assessment by doctors, assessment of decision-making capacity, psychiatric evaluation and confirmation of wishes, all of which are to some degree in the bill, are there. One thing which came up, which is why we tested it in the polling, was a desire for better checks into whether family members might have financial motivations to pressure a relative into seeking assisted dying. I think in one of the conversations, someone brought up the idea of sort of like credit checks, almost. Now, whether that is feasible and whether it is overly intrusive to people at a particularly low point in their lives remains to be seen, but it is worth flagging that. That said, despite concerns over safeguards, when you ask people about the balance of risk, a majority, 56%, believe giving people the freedom outweighs the risks that people are pressured. And interestingly, 71% of the public think that it is possible to design a system that allows those who are terminally ill to access support to end their own lives, that also has adequate safeguards, as opposed to 29% who don't. Again, those segments we talked about earlier, the splits are relatively similar. The progressive activists and loyal nationals, the somewhat unusual bedfellows on this issue, are most in favour, most likely to believe you can get this balance right. Backbone conservatives and established liberals the other way. Perhaps the biggest difference between the bill as drafted and public opinion is that the public would prefer the bill to be based on a list of conditions rather than life expectancy. There are a number of reasons for that. What comes clear in the focus groups is everyone has a story of someone surviving against the odds, and they worry about people prematurely ending their own life. But also the other way, people worry that there are some conditions, and again, it probably won't surprise you that it tends to be paralytic degenerative conditions, which come up most often in the context of this debate, that people may not be able to administer the medicine at the point that they have 6 months or less left to live, and that maybe a tightly drawn list of conditions would be a better way to think about the bill. One of the areas where the public are really torn is on dementia, and people really, again, doing the focus groups, it's quite powerful to see how people wrestle with this issue, because it's one of those things where they say, people often say, not everyone, obviously, generalizing, but the sort of media member of the public will say, gosh, if I was suffering from dementia, and particularly if my personality were going to change, and people have experience of relatives whose personality have changed, I would want to access it. But they also think that the principle of informed consent is so important and can't see a way of reconciling the two. So as is drafted, the current bill probably it sits on the right side of public opinion there, even if people would like to find a way for themselves, if they had dementia, to seek assisted dying. There's been a lot of discussion about NHS provision when it comes to assisted dying, not least given interventions from the Health Secretary on it. Interestingly, people tend to say that whilst they trust the NHS to make the right decisions, and a plurality would like assisted dying to be provided on the NHS. They don't think it's in the fit state at the moment to do so. Now, I should sort of caveat that with the fact that if you ask about almost any metric on the NHS at the moment, people don't think it's in a fit state to do so. People are really worried about the NHS. If you ask them about, sort of routine appointments, they would say the same thing. But it is a concern for people with the NHS in the state that it is in, whether it could deliver this service. So again, something to be reflected on. Interesting arguments around palliative care, however, tended to be much less convincing to people. So the argument that legalizing assisted dying might detract from end-of-life care didn't convince people, and people were very much in that it shouldn't be an either-or. So the concern was for the NHS in general rather than end-of-life care. A very, very strong view, particularly when you isolate the question that those with mental illnesses shouldn't be able to seek assisted dying to end their life. And indeed, we specifically asked about people with depression. One of the things, of course, to reckon, again, that lawmakers will have to reconcile with is that lots of people who have a diagnosis of a terminal illness will also have depression, and there's a minority, and you see it in the polling, you see it in the focus groups, about 1 in 5 who think it should be available to people with mental illnesses, but most don't, not because they don't see mental illness as serious, and there has been a real sea change in public opinion on mental illness in recent years, but simply because they think it is too we don't know enough yet about the extent to which people can recover and get better in the same way we do with physical illnesses. So what do we think based on all of that? And there are just 2 more slides. I'm pleased to say, again, we have no view on how MPs should vote on the bill, and particularly no view on how, and we make no recommendation for how they should vote at report stage or third reading or when it goes to the Lords. It does seem, based on support for the principle of assisted dying, but a desire to get the safeguards right, that it would be better for this bill to move to committee stage to see and properly test if those safeguards can be met. It would that would seem to be in line with where the public are at the moment. If it doesn't pass second reading, clearly, given public support, this shouldn't be the end of the issue. I don't think it would meet public expectations for this to be long rest for another decade, and others have made suggestions that should the bill fall, royal or expert commission should be established to go through this, and you can look at both assisted dying and end-of-life care, as Gordon Brown has suggested. That would seem to be the way forward. But I think it would be a mistake in public opinion terms for whatever happens on Friday to be and the end all of this debate for another decade. There'll have to be a discussion on the issues. If it does progress, more parliamentary time needs to be given to this. It is absolutely clear that the public only want to see assisted dying legalized if the legislation has been properly thought through and discussed. And our view is that despite the government's crowded legislative agenda, this is one of the most important votes that will be happening, and one of the most important issues that they should set aside more time in future. 5 hours of debate on Friday is not enough. And if you look at places like the Victoria State Parliament, where they legalised assisted dying and seems to be removing people's views one way or the other, but seems to be one of the better functioning approaches, they debated it for over 100 hours. There needs to be more consultation particularly with those of lived or personal experience of terminal illness in the family and expertise in end-of-life care. That should be looked at in the committee stage and further stages of the bill, including should the bill pass to the House of Lords. But also, I mean, I think this is probably the recommendation issue we feel most strongly about, even though it might seem like a minor one. There is definitely a role for civic institutions to step up and facilitate more debate on this issue. Of course, it's it is a fraught and difficult issue, and sometimes doing this research was difficult. But if you compare the level of debate and engagement on something like Brexit, or even, actually, I was at Stonewall when gay marriage passed, and was going through. There did seem to be more engagement, particularly from the likes of the BBC, but also the civic institutions. And, we think the principle, I know some MPs like Darren Jones have done town hall meetings. They seem like a good opportunity, because it shouldn't just be about those on the committee listening to people's experience. It should be more broad. Again, this is purely based on public opinion, and MPs have lots of considerations, but based on public opinion, they may want, in subsequent stages of the bill's passage, or indeed in any re-examination of the issue, to consider whether a list of conditions, rather than life expectancy, is the best way to define eligibility as per public opinion. As we discussed earlier, the area where the bill seems most in need of strengthening from a public opinion perspective at the moment is around financial motivations and coercion, and what checks could be added there. And then, unsurprisingly, while the public don't think that legalization will detract from end-of-life care, it is clear that whatever system is brought in needs to be properly resourced, given people's wider concerns about the NHS. That, I think, is everything from me. So I'm going to stop sharing my screen, but I am very happy now to take any questions that anyone has. I appreciate that was a lot of information. As I said, this live stream will be available on our YouTube channel, and we'll put it on the website, and I'll tweet it or something, or Blue Sky it, whichever one of the echo chambers you've decided to lock yourself into. I'll make it available on both. But very happy to take any questions in the chat, and someone will tell me how that happens. I think you type them in. Yeah, I've had a thumbs up from my team member. So if anyone would like to type in any questions, please do whilst I have a drink of coffee. Otherwise, I will stop. One thing I would really encourage you to do, by the way, is to go onto our website, because what we've done there is we have made available the open text responses from 2,000 people to why they support, oppose, or are unsure on assisted dying, and you can scroll through them. It's really interesting and quite mesmerizing. We've also got on there audio clips of people talking about their reasons in favor or opposed from the focus group. So that, they're really worth listening to. They're really quite powerful there. Final call for any questions. I should say the questions will be anonymous. We won't say the name of the person asking them. If you would like to do that. So I will give it another minute or so. But it's very easy for me if I don't have to answer any questions. Okay, I hope the technology is working and it's not just that we haven't been able to look at them. But what I should say is, look, please do get in touch if you want to follow up. I'm on luke@moreInCommon.com. I'm currently in the same room as the lead author, Ed. So ed@moreInCommon.com. Yeah, that's right, ed@moreInCommon.com. If you want to email either of us, we're more than happy to discuss this. Thank you.